नमस्ते बिटिया, हमेशा खुश रहो बिटिया। Myself Dr. Arti Purohit, Associate Professor, Department of Pathology, Faculty of Homeopathic Sciences, JAYOTI VIDYAPEETH Women's University. Our today's topic of concern is the yellow fever. Yellow fever is an acute viral hemorrhagic disease. It belongs to the family Flaviviridae, genus is Flavivirus, and originated in Central Africa. 1,70,000 cases, up to 60,000 deaths have been recorded. Positive sense single stranded RNA enveloped flavivirus having 50 to 60 nanometer diameter. Pathogenesis and pathology. The virus is introduced by a mosquito through the skin and spread to the local lymph node where it multiplies. From the lymph node, it enters the circulating blood and becomes localized in the liver, spleen, kidney, bone marrow and lymph gland, where it may persist for days. The lesions of yellow fever are due to the localization and propagation of the virus in a particular organ. Infections may result in necrotic lesions in the liver and kidney. Histologically, the liver shows cloudy and fatty degeneration and necrosis, which is typically mid-zonal. The necrosed cell coalesce and become hyalinized lining, leading to the formation of characteristic eosinophilic masses known as councilman bodies. Acidophilic intranuclear inclusion bodies may be seen in the infected liver cell in the early stages. Clinical findings include the incubation period is 3 to 6 days. There is a yellow eyes, headache, backache, vomiting, bleeding. Death occurs on the day 7 to 10th illness. About 15% of cases, the disease progresses to a more severe form with fever, jaundice, renal failure, and hemorrhagic manifestations. Epidemiology show the two major epidemiological cycles of the transmission of yellow fever are recognized. One is the urban yellow fever and second is the forest or sylvatic cycle. In urban yellow fever, in the urban cycle, human act both as a natural reservoir and as a definitive cases. The virus being transmitted by the domestic Aedes aegypti mosquito. The forest and sylvatic cycle. In the forest and sylvatic cycle, the wild monkey act as a reservoir and forest mosquito Hemogobus cipizini is South American and Aedes africanus and Aedes simpsoni in Africa as a vector. Human cases occurs only when human trespass into the forest or when the monkey rages villages near the forest. Yellow fever is largely confined to Central and South America and Africa. Yellow fever has never invaded Asia, even though the vector Aedes aegypti is widely distributed there. It is likely that stray virus introduced may have been kept out due to the prevalence in the local Aedes aegypti of dengue virus and of antibodies to the wide range of arbovirus in the local population. Another reason could have been that in Africa, yellow fever was mainly in the west, and in India, Aedes mosquitoes were along the east coast, so that even stray importations of virus by sea may not have found suitable vectors. This is no longer valid as yellow fever has in if ever yellow fever get established in India. The consequences could be catastrophic. Diagnosis. The blood test RT-PCR can sometimes detect the virus in the early stages of the disease. In later stages of the disease, testing to identify antibodies is needed. ELISA and PRNT. Viral detection or isolation is their serological test where the IgM antibody by ELISA captured in a single sample provide a presumptive diagnosis with confirmation by a four-fold or greater risk in titer of neutralizing antibody between acute phase and convalescent phase serum samples. 17D vaccine. A safe and equally effective vaccine, the 17D vaccine was developed by Thiele in 1937 by passaging the SEB strain serially in mouse embryo and whole chick embryo tissue and then in chick embryo tissue from which the central nervous system tissue has been removed and has been used as a vaccine for over 40 years. The 17D vaccine is thermolabile and is administered by subcutaneous inoculation. Immunity develops within 10 days of vaccination. The vaccination, which is mandatory for travel to from endemic areas, is valid for 10 years, beginning 10 days after vaccination. In India, the 17-day vaccine is manufactured at the Central Research Institute, Kasali. Treatment. The patient should be hospitalized for supportive care and close observation. Rest, fluid, and use of pain relievers and medication to reduce the fever may relieve the symptoms of aching and fever. Care should be taken to avoid certain medications such as aspirin and other non-steroidal anti-inflammatory drugs which may increase the risk of bleeding. Yellow fever patients should be protected from further mosquito exposure for up to 5 days after the onset of fever. Prevention is yellow fever vaccine. YFVAX licensed in the US, which is have announced that YFVAX will be unavailable from mid 2017 to mid 18 because of delay in the production process. This is my reference book, and I hope you enjoyed this session. You understand the topic, and if any queries there, please mention it in comment box. Thank you.